Hi, everyone. My name is Dr. Samantha Smith. I am a physical therapist that specializes in knee replacements. I have a great sitting workout for you today. You can do this pre-surgery or post-surgery. So let's get started. All you're going to need is a chair. We're going to do all of these exercises for 1 minute. All of these exercises are beneficial for a knee replacement, specifically pre or post surgery. They work the quad muscle, they work the hamstring, we're working the shin and the ankle, working on range of motion. Let's get started. Our first one here, I'm going to have you sit up at the edge of the chair. We're going to work on our core control with this. I want you to open up the knees. We're going to do side marches here. So marching out to the side can be a little bit easier on the knees, especially if you are pre-surgery or maybe you're a couple weeks post-surgery. This can be a little bit less intense of an exercise compared to just big marches starting right away. So this is just a warm up. These first couple exercises here. Keep that good upright posture. We're working the core. Try not to sway side to side either. That is cheating. You have to work those core muscles. You got it. Only 15 more seconds left, and then we'll switch exercises. So I have knee replacement courses on my website, and I have exercise classes where I bring you through a ton of different exercises just like this. Our next one here, we're going to work on open and close. So step open and step close. Again, good upright posture. I want you to work on that core. Try not to lean back and forth. That is a way to compensate. Do the best you can. We have another 30 seconds here, open and close. You're doing great. So my exercise classes goes over exactly what exercises you need to be doing after your knee replacement. Just go to my website, succeedcourses.com. There is a ton of information on there for you guys. There are tons of blog posts on there for you too, with free information all about knee replacements, all written by me as well. And please go read them because I spent a lot of time writing those. Okay, next one here. We're going to sit back in our chair just a little bit. I want you to pick one knee. You're going to externally rotate the ankle out to the side and then kick forward. So keep that foot externally rotated. 30 seconds here. And then we're going to do the other leg. So we're working the rotation of the knee, which can be helpful a lot of times with knee arthritis. If you're pre-surgery, this rotation might be a little stiff. So this is good to work on. Post-surgery as well, you're still going to have rotation of the knee. Maybe not as much though. Almost done. 5 more seconds. Then we'll switch. Keep that upright posture too to work on that core, that back. Switch sides. That was more than 5 seconds. Externally rotate that foot and kick up and out. Here we go. Doing good. Don't lean back in that chair. I know I was about to. That's why I said that. You're doing great. Working those quad muscles. That is so important after surgery. Your knee replacement quad is 60% weaker than the other one. That is huge. Let's switch back to the other knee. I'm going to have you internally rotate the foot and then kick forward. The internal rotation is going to be a little bit less range of motion compared to the external rotation. So just do the best you can. Weak quads contribute to knee buckling, to falls, to poor gait patterns, to hip pain, back pain. So got to get those quads strong. All of these exercises we're doing here are most beneficial for knee replacement specifically. That's why all these exercises I've chosen for today's workout, all for knee replacement patients. Really great exercises. Switch to the other side. Internally rotate that foot. It's going to turn in and then kick forward. Again, working on that rotation, working on quad control. Doing great. Some of you post-surgery might not be able to fully extend the leg out like this. That is a hard one to do, especially in the first couple weeks. Some people have really great quad contraction right after surgery. Some people, it takes them several weeks to get it back. Okay, come to the edge of the chair. Let's work on those big marches that I was talking about at the beginning. So with this one, I want you to use your hands to help lift it up towards you. Just a slight control with the hands. Try to get those hip flexors to do most of the work. The hip flexors are the muscles that lift your legs up like this. So those hip flexors are important for getting into the car. You need to be able to lift your leg up and over into the car, right? For getting into the bathtub, for getting into bed. We need those hip flexors. So this is a great one. Just use those hands a little bit to help bring them up even further and stretch those hips. Almost done. 5 more seconds. Doing great. Okay, scoot back in the chair. Once you bring both legs out in front of you, we're just going to kick the legs just like this, working on the quad endurance. Quad endurance is also very important. We have to have good endurance of our muscles so we can stand for long periods of time, so we can walk for long periods of time. Very important. So this is a great quad endurance type of exercise. Good posture with this one. I felt myself kind of leaning forward, so sit up nice and tall. Work those posture muscles, work the core, work the back, work the quads. A little bit of everything with this one. 5 more seconds. We'll do 40 seconds with this one. Okay, next, come to the edge of the chair. Leg out in front of you, heel is on the ground. My bottom is scooted all the way to the edge of the chair. I'm going to try to lift my leg up and down. The thigh comes off of the chair. This is a hard one. We're just going to do 10. There's 3, 4, 5. You should feel it burning in the hip flexors. 6. Keep going. 8, 9, and 10. Good. Switch legs. Same thing. Lift that thigh off of the chair. Work those hip flexors. Working the quad as well. Working the core muscles. I feel myself wanting to go backwards with this one, so I have to really work on my core control. Good. I believe this is 6. Almost done. 7. Try to get that thigh off of the chair. 9 and 10. Good. Okay. Scoot back in your chair just a little bit. Feet up out in front of you, just like we did before. I'm going to have you crisscross over and under, over and under. Good. Keep going. 30 seconds here. Again, working the hip flexors, working the core if you're not leaning back, working the quad. My quads are burning. I can feel them working. Almost done. We have one more exercise and then we're going to stretch at the end. Always do your stretches at the end of your workout routine. You want those muscles loosened up. Stretching cold muscles is not beneficial. So don't ice and then stretch. That doesn't work as well. You want to exercise and then stretch. Okay, come to sitting. Good posture here. I want you to keep the feet planted on the floor. We're going to externally rotate the ankles, come back. So with this one, keep the knees straight, just like this. Don't rotate them out to the side. I want you to keep those knees in one position. We're just working the ankles. The heels stay on the floor. Just rotating out to the side. Again, working on that external rotation of the shin bone, which is connected to the knee. That can be really helpful with pain control and just mobility of the knee in general. Doing great. Let's do about 10 more seconds and then we'll stretch. Very good. Okay, next one. Have to sit to the edge of the chair with this one. Foot out in front of you, just like this. Heels on the ground. My knee is completely straight. My leg over here is just on the floor for balance. You might feel the back of the knee stretching already with this stretch. If you don't, I want you to lean forward with your chest, good posture, with your chest forward. Don't round and lean. Good posture with this one. Hold it here another 10 seconds and then we'll switch legs. So all of these stretches and exercises in my exercise class, we make them a little bit harder each week. So I have a 4-week exercise class you could join, and each exercise class gets a little bit harder. The members in the class or the people who've taken it previously have reported so many good things. Check the reviews of the class. You'll see what I'm talking about. Okay, switch sides, same thing, heel on the ground. That knee is straight and lean forward if you need a little bit more stretch. Doing good. But we had reports of just decreased pain, improved mobility, improved balance, less stiffness. People saying they could finally get off the toilet without using their hands. So, a lot of benefit to doing the right exercises, and that's what I can help you with. Okay, next stretch we're gonna do. I'm gonna have you put your ankle on your opposite knee. So, this one can be tough for some of you who don't have the hip mobility. If you don't, that's okay. Just do the best you can. You might need to extend the leg out like this and put it down a little bit lower. But for those of you who can do this pretty good, I want you to push this knee down towards the floor. And then the other ankle, you're going to bring it in towards you. Really get that knee to bend and the hip to stretch as well. Okay, let's hold it 10 more seconds and then we'll switch sides. Hip mobility is imperative to your knee. If you have tight hips, let's switch legs. If you have tight hips, your knee is not going to function as it should. So we need to stretch the hips. Again, in my exercise class on 68courses.com, we go over a ton of hip mobility work and hip strengthening work to make sure your hips are strong and supporting your knee. You do not have to be in pain forever. That is not the goal of a knee replacement. And I know a lot of times you guys are going to the surgeon requesting help and they're saying, well, your x-ray looks fine. I don't know what to do for you. That's when the physical therapist comes in. Let's rest. The physical therapist is the one that needs to help you with your pain, your stiffness, your swelling, your aching, your stiffness. I already said stiffness, all of those symptoms. We're the ones that help you with it. So if you need help with your symptoms, please contact me. You can email me, send me a comment below. I'll send you to the right course or exercise class on my website so you can join and I can help you with your knee replacement. Thank you so much for joining me today. I will see you guys again in my next video.